Types of urinary incontinence. Let's talk about something we all definitely didn't plan to talk about today: urinary incontinence. Yep, we're going there. Because while it's not exactly dinner table conversation, it is something that affects millions of people. And maybe even your favorite aunt, your neighbor Bob, or hey, you, no judgment. So what exactly is urinary incontinence? Think of it like your bladder acting up and deciding to throw a surprise party without your permission. Medically speaking, it's the loss of bladder control, and it's a pretty common symptom of a condition called overactive bladder, aka OAB. This delightful syndrome includes symptoms like urinary urgency, frequent urination, and the kind of nighttime bathroom visits that ruin a perfectly good REM cycle. According to the American Urological Association, up to 30% of women and 5% of men in the U.S. experience urinary incontinence. That's not just a statistic, it's practically a support group. But here's the kicker. Bladder leakage isn't just caused by OAB. Nope. Urinary incontinence can also come courtesy of a variety of other medical issues or life changes. It's got range, from pregnancy to prostate problems, from menopause to mysterious nerve signals. This condition has more plot twists than a soap opera. Let's clear up one big myth while we're at it. Urinary incontinence is not just a normal part of aging. Yes, aging can weaken the muscles that help control your bladder. But if your body is giving you the constant urge to sprint to the bathroom or you're having leaks you didn't RSVP to, there might be something else going on. That's why knowing the different types of urinary incontinence is key. Each type has its own causes, quirks, and treatment approaches. It's like a cast of characters, and once you meet them, things start making a whole lot more sense. Stick around as we break down the types, symptoms, and what to do when your bladder decides to go rogue. You're not alone, and more importantly, you're not helpless. Let's dive in. Types of urinary incontinence. Meet the leaky culprits. Let's meet the usual suspects in the world of bladder betrayal, because yes, urinary incontinence comes in more than one flavor. And spoiler alert, none of them are particularly fun. Urge incontinence, the sneak attack. First up, urge incontinence, also known as the gotta go right now or else type. You're minding your business, maybe scrolling through cat videos or walking to the kitchen. In BM, your bladder launches a full-on emergency. You rush to the bathroom like it's the finish line of a marathon, but sometimes you don't make it in time. Urge incontinence is often linked to overactive bladder, OAB, the drama queen of urological syndromes. And just like any diva, it comes with a whole entourage of symptoms like frequent urination. We're talking more than 8 times a day. Nocturia, your bladder's late-night party trick, waking you up to pee multiple times. If your bladder's been acting like an impatient toddler who can't wait 5 seconds, it might be time to have a chat with your doctor. OAB and urge incontinence are manageable, but only if you stop pretending it'll just go away. Stress incontinence, the laugh till you leak situation. Next on the roster, stress incontinence, aka the oops I laughed / cough / sneezed / jumped / did absolutely anything and now my pants are wet variety. Stress incontinence is basically your bladder losing the plot when there's pressure on it. Sounds small, but imagine leaking pee every time you giggle. Suddenly, stand-up comedy becomes a hazardous activity. In women, this is the most common type, thanks in part to the wonderful joys of pregnancy and childbirth. Turns out carrying a tiny human, or pushing one out, can weaken the pelvic muscles and make your bladder a bit twitchy. In men, it's often tied to prostate surgery, especially prostate removal. When the nerves and muscles responsible for bladder control get compromised, things can start to slip, literally. And guess what? Tumors, or abnormal growths, can also put pressure on the bladder in both sexes. Because if there's one thing stress incontinence loves, it's an unexpected plot twist. Think we're done? Not even close. There's still a few more types of urinary incontinence we haven't introduced yet, including the kind that happens when your bladder doesn't quite know when to empty, and another that's basically a greatest hits compilation of all the types. Stay tuned. And yes, you can go to the bathroom first. Just come back. We've got more leaks to plug. Mixed incontinence, the double trouble combo. Can't decide whether your bladder leaks because you sneezed, or because it just felt like it? Good news, you don't have to choose. Introducing mixed incontinence, the combo platter of bladder issues. It's basically a mashup of urge and stress incontinence. You get the sudden, urgent run for your life, urges plus the leaks from everyday pressure like laughing, coughing, or doing that one jump in Zumba class you totally weren't ready for. Mixed incontinence is common in people with overactive bladder, but it can also point to other culprits hiding in the background. Things like urinary tract infections, diabetes, or even neurological disorders like Parkinson's or multiple sclerosis. So if your bladder is doing both the surprise attack and the leaky laugh routine, congratulations, it's confused, and your doctor should definitely know about it. Overflow incontinence, the silent spiller. Now let's talk about overflow incontinence, the sneakiest one of the bunch. This happens when your bladder doesn't fully empty, even though you think you just went. Then later, surprise, you leak. It's like your bladder was holding on to a secret, and it just couldn't keep it anymore. People with enlarged prostates, narrow urethras, or weak pelvic muscles are especially prone to this one, particularly men. It's the bladder version of that one friend who bottles everything up until they explode, just, less emotional and more damp. Functional incontinence, the great race that you sometimes lose. Lastly, we've got functional incontinence, which despite the name, is anything but functional. This kind happens when your bladder's ready, but your body or brain isn't on the same page. Maybe it takes too long to get to the bathroom. Maybe arthritis makes your pants impossible to undo in time. Or maybe memory issues get in the way of realizing you even need to go. It's not about the bladder being faulty. It's about everything else getting in the way. That's why this type is often linked to disabilities, mobility challenges, or cognitive conditions like dementia. It's frustrating, it's unpredictable, and it's absolutely valid. This type deserves just as much attention and care as any other. Final flush, what now? If you're experiencing any of these types of incontinence, or even a few at once, don't play the guessing game. Your doctor can help figure out which category you fall into, and no, leaky mess isn't an official diagnosis. From lifestyle changes to medication and even physical therapy, there are plenty of ways to take control of your bladder back. Because let's be honest, you've got better things to do than scout every building for the nearest bathroom. Stay informed, stay empowered, and remember, leaks happen, but help is out there. Risk factors. Who's most likely to spring a leak? All right, now that we've met all the quirky cast members of urinary incontinence, let's talk risk factors, because your bladder didn't just wake up one day and choose chaos. There are some usual suspects behind the scenes, quietly upping your odds of dealing with leaks. Let's break it down. 1. Gender. Ladies first, unfortunately. Sorry, ladies, this one's on you. Urinary incontinence affects women twice as often as men, and stress incontinence is the main culprit. Why? Blame biology. Things like pregnancy, childbirth, and the hormonal roller coaster known as menopause can all put pressure, literally, on the bladder. 2. Age. The bladder gets moody with time, like your joints and your ability to enjoy loud music. Your bladder also starts to shift as you age. Muscle weakening, menopausal hormone changes, and just the general effects of time can all cause those oops moments to creep in. Bottom line, aging gracefully doesn't always include your pelvic floor. 3. Family history. Thanks, genetics. Got a parent or grandparent who's on a first-name basis with every public restroom in town. You may be a higher risk, too. Sometimes, incontinence runs in the family. So, if your family tree has a leaky branch, take note. 4. Weight. More pressure, more problems. Carrying excess weight can put extra pressure on your bladder, especially when sneezing, laughing, or moving suddenly. That pressure? It's a VIP invite for stress incontinence to show up unannounced. 5. Smoking. More than just a lung thing. Think smoking only affects your lungs? Think again. Smoking not only worsens OAB symptoms, but the chronic coughing it causes can turn every cough into a mini leak. It's like a built-in water hazard every single time you clear your throat. 6. Medical conditions. The bladder drama boosters. Certain health issues bring bladder issues along for the ride. We're talking pelvic tumors or growths, space hogs, basically, diabetes, which messes with nerve signals, neurological diseases like Parkinson's or multiple sclerosis, which can disrupt your body's communication system and confuse your bladder. Even if you check off a few of these boxes, you're not doomed to a lifetime of strategic clothing choices and emergency bathroom scouting. Understanding the risk factors is the first step in getting ahead of the issue, and maybe even preventing it altogether. Talk to your doctor, treat your bladder like the VIP it is, and remember, knowledge is power, and so is a strong pelvic floor. Diagnosis and treatment. Don't just live with it, fix it. Let's get real for a second. Urinary incontinence can seriously mess with your lifestyle. Whether it's skipping workouts, avoiding long car rides, or scouting every building for the nearest bathroom, it's exhausting. The good news? Most types of urinary incontinence are treatable. But first, diagnosis. Before anyone starts handing out prescriptions or recommending fancy gadgets, your doctor needs to figure out what exactly is going on. That means clinical tests like urinalysis, possibly imaging studies or physical exams. And yes, you may be asked to keep a bladder diary, kind of like journaling, but for your pee. Once your doctor has a clearer picture, it's time to choose the right treatment path, starting with the least invasive option and working up from there. Behavioral methods. Training your bladder like a boss. First up, behavioral methods, aka the DIY phase. Doctors love this route because it's simple, non-invasive, and surprisingly effective. You might be asked to cut back on caffeine or other bladder irritants. Try time voiding, yes, peeing on a schedule. Do bladder training to stretch out time between bathroom breaks. Practice pelvic floor exercises, yes, those famous Kegels you've heard about. Basically, you're teaching your bladder who's boss. And sometimes, that's all it takes. Medication. When your bladder needs backup. If your bladder's still not cooperating, it might be time for medication. Depending on the type of incontinence, your doctor may prescribe anticholinergics to calm down overactive bladder muscles. Beta, 3 agonists to increase bladder capacity. Topical estrogen to strengthen tissues in postmenopausal women. Even antidepressants, which, surprise, can help tone the bladder muscles in some cases. Every body is different, though. What worked for someone else may not work for you. Side effects happen, and you might need to play the trial and error game for a bit. Annoying? Yes. Worth it? Absolutely. Advanced therapies, when it's time to level up. Still dealing with leaks despite your best efforts? Welcome to the big leagues. Electrical stimulation. One option is sacral neuromodulation, which sounds sci-fi, but is basically your bladder's version of a Bluetooth upgrade. Devices like the Azonics therapy system gently stimulate the sacral nerves, the ones responsible for coordinating your bladder's signals with your brain. It's kind of like giving your bladder's communication team a wake-up call. For some people, this treatment helps reduce or even eliminate symptoms when other methods have failed. Surgical options. Depending on the underlying cause and severity of your incontinence, surgery may be an option. This could involve sling procedures, bladder neck suspension, or other surgical fixes to help restore control. Bottom line, hope and dry pants are possible. No matter which type of urinary incontinence you're facing, the worst thing you can do is ignore it or accept it as just part of getting older. It's not. You deserve answers, options, and dignity. So don't suffer in silence. Talk to your doctor. Keep a bladder journal. Try the treatments. And if necessary, explore advanced options like Azonics therapy. Because life's too short to be ruled by your bladder.